and that may be the sign of diabetes. Now, all these features, they develop kind of suddenly in type 1, but type 2 diabetes mellitus is one in which there is a sufficient production of it, and that leads to total destruction of the beta cells, and there isn't any insulin to take care of the body. Hence, I remember a patient coming to my office, and he was about 26-year-old, and he was told to be diabetic type 1 for the last 9 to 10 years. And he was quite sure that he was having a type 1 diabetes, but unfortunately it was totally uncontrolled, and he was in a lot of agony due to the complications. Even the kidneys were affected, and so many other things were happening. So when I looked at the data, I was shocked to learn that he wasn't really investigated for the type of diabetes that he had. So what I ended up doing was that I got a test done called fasting C-peptide level. And it turned out that this patient, or the young man, was never really type 1 diabetic. He was having diabetes mellitus type 2. In which the fasting C-peptide levels and the insulin reserves are already normal. He was never really in need of insulin that he had been taking for the last 9 to 10 years. And that resulted in a lot of weight gain, a lot of uncontrolled blood sugar level, with dipping and rising of blood sugar level, and the patient being frustrated, and the complications started to rise much earlier than expected. In this video, I'm going to talk about what are the signs, symptoms of diabetes mellitus 1 and 2, what are the causes, what are the complications, and what are the difference in terms of treatment. So let's start with initial step. What is the cause of type 1 diabetes versus type 2? Type 1 diabetes is the one in which there is an area within the pancreas called the beta cells. These are destroyed by our own antibodies. Our antibodies consider these beta cells to be the enemy, and they directed their all energies in destroying those beta cells. And there is also involvement of some cellular attack on the beta cells too. And that leads to total destruction of the beta cells, and there isn't any insulin to take care of the body. Hence, the patient suddenly develops a rise in blood sugar level and presents to the hospital emergency or the doctor's clinic and is discovered to be having diabetes. If that patient is checked for fasting C-peptide level, which is the test that I got done in the initial story that I told you, it would have been below normal because there isn't any factory of insulin within the body. This test is normal when there is a sufficient production of insulin within the body. On the other hand, the type 2 diabetes mellitus is one in which there is a sufficient production of insulin in the initial part of type 2 diabetes. Yes, I again say that there is no deficiency of insulin in the initial part of type 2 diabetes mellitus. The only problem is there is resistance. Now, insulin is just like this key, and it needs to be placed in a lock. If the lock has some glue in it and we cannot put it in there, there is a resistance to it. Just like insulin is unable to open the lock and push glucose from the blood to the cells. So this insulin resistance leads to rise of glucose within the vessels. So even if we give a lot of keys like that and the resistance remains there, it's not going to help. So the problem is the glue or the resistance, not the deficiency of the key. If we do a fasting C-peptide level in type 2 diabetes mellitus, in this case, it would turn out to be normal or even above normal. Yes, you heard me right. It can be even above normal because of the fact that the insulin is ramped up. Because of the resistance, the beta cells tends to overcome the resistance by producing more of insulin. So actually, type 2 diabetic patients are having more insulin levels in the initial years of their disease as compared to somebody who doesn't have diabetes. So important thing in that is if the patient develops symptoms. The symptoms are usually sudden in the case of type 1 diabetes, and these are usually chronic or the slow simmering kind of symptoms in case of type 2 diabetes. What are the symptoms? I already previously narrated in my last videos. This is increased thirst, increased urination, increased feeling of hunger. Along with that, there can be blurring of the vision, there can be darkening of the skin, there can be slow healing of the wounds. Along with that, there is undesirable, you can say, kind of fatigue, which is not usually usual for you for the same exertion that you used to do. And now you are getting fatigued so early as compared to your previous days. There is also unplanned or unwanted weight loss, and that may be the sign of diabetes. Now all these features, they develop kind of suddenly in type 1, but they slowly over the period of time grow in type 2. So as I have already mentioned, in this case, if the treatment is to be given, the doctor is going to give you insulin for type 1 diabetes mellitus because the factory isn't there, so it has to be replaced. There is nothing wrong with the lock and the glue model. But on the other hand, if you are having a type 2 diabetes mellitus, the insulin is already sufficient. You are not in need of insulin to begin with. Your first target should be to remove the glue from the lock so that the key can be placed. There are already sufficient amount of keys within the body, and the glucose can be transferred into the room when the lock is open. But if we are unable to diagnose at this point in time and the patient is wrongly labeled as type 1, but when he was actually type 2, like in my case, what happens is that you are carrying on with the insulin. It's just like giving more and more and more of keys while the lock is still there with the glue, and none of them is going to work. And even if it works, it's not going to be a satisfactory response. The blood sugar control is going to be all over the place. So let's focus on what complications can arise if somebody is having type 1 versus type 2 diabetes mellitus. In type 1 diabetes mellitus, there is a reduction of the expected lifespan from 10 to 20 years. That's a huge number. That's unfortunate. But with a good control, this can be reduced to a lot less. Same is true for diabetes mellitus type 2. The lifespan is reduced by 6 to 10 years. But if you are having an excellent control, you don't need to worry about it. Regarding the percentage, if there are 100 people in the world who are having diabetes, only 10 of them will be having type 1 and 90% will be having type 2. And considering those stats, if somebody is having a heart disease, what are the chances? The type 1 diabetic patients having a heart disease are relatively less likely to be having some significant cardiac disease to begin with. On the other hand, type 2 diabetic patients have 2 to 4 times the risk of having diabetes mellitus. On the other hand, the nephropathy, the retinopathy, and all those features, they are very prevalent in type 1 diabetes mellitus. Although heart disease does happen in type 1, but type 2 are more likely to have that. Most of the complications that I have talked about, and one of the most famous one is diabetic ketoacidosis. It comes in a flash in type 1 diabetics, and most of them are having diabetic ketoacidosis, a condition in which there is a lot of acidity within the body and there is shortness of breath, vomiting, altered state of consciousness, and the patient needs hospitalization, IV insulin, IV fluids, and maybe supplemental few other things. On the other hand, type 2 diabetic patients are very less likely to have ketoacidosis. They do have an hyperosmolar state, but that is beyond the scope of this discussion. So let's summarize the fact. Type 1 diabetes, there is lack of insulin. The symptoms are relatively sooner and sudden, and it tends to happen in the young people more. Type 2 diabetes mellitus, on the other hand, is related to resistance. The insulin production is okay. We should work on the insulin resistance. It usually happens in the adult age, but just like my first index case, this type 2 diabetes mellitus is now seen in even the teenagers who are having overweight and the genetic predisposition. So don't consider our age to be a compelling indication that this is type 1 diabetes mellitus and not type 2. Stay safe, stay healthy, stay informed. Thank you so much.